Good afternoon, everyone. My name is Jeff Cooper, Health Commissioner at Public Health, Dayton, Montgomery County. Thank you for being here today. On behalf of Public Health, we're also pleased that we have several speakers today again. We have Mayor Whaley from the City of Dayton. We have Casey Smith, who is our project manager for the Community Overdose Action Team, who will be providing us an update on the Public Health Information Line. And then we have Sarah Hackenbrack from the Greater Dayton Area Hospital Association. Just a couple of comments on the Governor's news conference today. We found the comments from the Lieutenant Governor Husted very optimistic in terms of that Dispute Resolution Commission. And so that's what we have wanted all along. We at Public Health Dayton and Montgomery County do not want to be making a determination that's different than other health departments across the state are making. We all want to make sure that we're consistently applying our expertise and making a unified decision regarding the stay-at-home order. So we're very pleased that that process is up and running, and we look forward to then any complaints regarding any type of conflict regarding what we may decide versus a surrounding county or another county in the state that has a similar business. We want to make sure we make the same decisions. So that process will help ensure consistent decision making. And then we found Dr. Acton's comments very optimistic. If you look at the key indicators regarding flattening the curve in Ohio, it's very obvious that as a state we have made great strides in terms of this mitigation phase. And if you look at the COVID dashboard for the state, it's pretty obvious that we are approaching the peak. And that curve is much flatter than any of the modeling projected. That is fantastic news for this state. But we also all need to remember that, as Dr. Acton indicated, without a vaccine, we are likely to experience spikes in cases again until we have that vaccine. And that may be another 12 to 18 months. So we all need to continue to do our part and make sure that as the governor then has the data with the Ohio Department of Health to make decisions in terms of when he begins to reopen this state and we move into the recovery phase. But certainly the numbers that we have so far are very optimistic compared to what we were hearing several weeks ago. So I think we start seeing this national discussion, state discussion, and trend towards individuals with underlying health conditions and how they are at much greater risk of adverse events associated with infection of COVID-19, especially the very young and or older adults. So individuals with chronic health conditions such as heart disease, cancer, anyone with immunosuppression, diabetes, obesity, liver and kidney disease, asthma. Those individuals with those health conditions tend to be at much greater risk of either a serious or a critical health outcome associated with infection. And so that's especially relevant to our community. When we look at the health status of Montgomery County, and if you look at all of the national county health rankings that we typically get every year, we tend to find that as a county, oftentimes for many of those conditions, we tend to fare worse than other counties in Ohio or nationally. So, for example, our life expectancy compared to the national life expectancy is a little lower. In terms of birth outcomes and the number of babies that die before their first birthday, our infant mortality rate is high. What's especially troubling is that black babies die at a rate that's higher than the rate at which white babies die. If you look at the number of people who are dying of a drug overdose, obviously we all understand the heavy toll that the opioid crisis has taken on our community. And then if you look at those other conditions, so rates for heart disease, diabetes, cancer, obesity, and asthma, and if you break those down into disparities in health outcomes among races, it's very significant. So if you're a black male, normally, without this pandemic occurring, you're dying at a rate for diabetes and heart disease that's 2 times the rate at which the general population dies of those diseases. Lung cancer is our most common form of cancer and responsible for the most deaths associated with cancer, and that's because approximately 23 of our adults continue to smoke on a daily basis. 2/3 of our adults in this county are either overweight or obese, and about 25% of children are either overweight or obese. And then asthma. If you take a look at the hospital admissions or hospital emergency department visits, asthma is the 4th top cause of hospital emergency department visits in this county. So all of those factors make this pandemic especially difficult for this community because our overall health status obviously needs to improve. So that means that all of our collective actions are that much more important to make sure that we take care of each other. Every presenter that's here today, whether it's Mayor Whaley or Sarah Hackenbrack, others that have been here, Dr. Doan, they've all said from the very beginning that we all have to make sacrifices to protect each other. So, which brings us to the topic of wearing a cloth face mask. I think it's clear that for most of us, as we're out and about for an essential activity, we've personally witnessed not enough individuals wearing a cloth face mask, even though that's a national, state, and county recommendation. So let's face it, you've seen it at restaurant carryouts, or convenience stores, or gas stations, or home improvement stores, or pharmacies, or supermarkets and groceries, and many other essential businesses. They may be posting the maximum occupancy allowed, but what they're not doing is assuring that individuals are wearing a cloth face mask. And that's what we really need to move to make sure that we continue to flatten the curve to where then this state and this community is in a position to where we can begin to reopen and enter into the recovery phase. So when you look at and Casey Smith will talk about this a little bit when she provides information on or data on our information line. We're beginning to get individual citizens calling in expressing concern that other citizens are not wearing a cloth face mask when they're out in public, and they're not being cognizant and aware of what's needed for social distancing when they're out shopping. And so it's just a friendly reminder, this is something that we all need to do. So we're going to ask our community, please, as common courtesy, please wear a face mask, a cloth face mask, not a medical face mask, but a cloth face mask. It does a couple things. Number one, if you, it helps that if you have any symptoms, number one, you should be staying home, but even if you're asymptomatic, it would help prevent the spread of that virus. And it protects employees of the essential businesses that you frequent and support. And so help further slow the spread of this virus. Please wear a cloth face mask when you're in public. So we all have to do our part to make sure that we continue to flatten this curve so that Ohio's in a position to quickly recover from this pandemic. If you look at the data, and these data are on our website, we create a data report every day and we place it there. If you look at the most populated areas, the most populated counties of the state, you will see of the top 7, Montgomery County has the fewest number of cases reported in this state of all of those urban locations. And I think that's a reflection of the outstanding work that every community partner is doing in this county, as well as all of our citizens taking this very seriously. So let's continue that effort, and let's make sure we continue to prevent the spread of this virus. We slow the spread. Let's put on a cloth face mask. Also, if you look at the rate then of cases, so not just the number, but the rate per 100,000, you'll find that Montgomery County is 34th out of 88 counties. So that's fantastic. We just need to continue that to make sure that we're all protecting each other. And with that, I would like to welcome Mayor Nan Whaley to the podium.
Thank you, Commissioner, and I hope that you had a quiet weekend at least this past weekend. I don't have much to add besides just a congratulations to the folks in the community that have pushed us to the 34th out of 88th in the state. The state of Ohio, as we know, is doing really, really well in changing and flattening this curve, showing that social distancing and this physical distancing works and that these efforts are paying off. But for Montgomery County, which is the 4th largest county in the state population-wise, to be 34th shows just how much great work the community is doing. I want us to start considering, as we are all obsessed with how we get back to normal, I want to prepare the community to the fact that we will be different after this no matter what. And as the governor has talked about how we will reopen, it is not going to be the same, certainly this summer. It is very unlikely we will have large events in this community and across the state, and it is very likely that we will wear cloth masks for a good amount of time moving forward as we reopen. The considerations for reopening, we're already seeing the hospital numbers, as Sarah talks about every day, going down, which is a great sign. But what aren't great signs is adequate amount of PPE, which we still don't have, and plenty of testing. Again, another problem. And so until those efforts are fixed, not only across our community, but across the state and country, it's going to be very difficult for us to be able to be open fully. Because we'll need to do a lot of testing to make sure as these spikes come along that we don't have to close down the entire economy like we've done this past time. So I encourage you to consider your patience, consider things that you can do to get through this time. I know that Lori Chris from Mental Health Services, we had Helen Jones-Kelly here Friday, and this week she's talked about thriving for 5, reaching out to 5 people that you normally don't reach out to. I've been doing that every day. I think it's good for yourself, but also good for others, because as we continue the social distance, we'll have to also consider to make sure that we take care of those around us. So be thinking of those actions, because while it's April 14th, and I know I don't think it is responsible to think that by April 30th we will be all done with this. So I want everyone to start thinking about that, and we'll continue to talk about that more. But I want to thank the community for doing such a terrific job to really make Dayton and Montgomery County shine through this physical distancing and taking care of their neighbors so well. Thanks, Commissioner.
Thank you, Mayor Whaley. Next, we have Casey Smith, Project Manager for the Community Overdose Action Team.
Good afternoon, everyone. My name is Casey Smith, and I am the project manager for the Community Overdose Action Team. I am also helping lead our COVID-19 call center. So just some background, the call center did begin on March 12th of 2020. We have now been operational for roughly 1 month. The call center was really established to answer questions about COVID-19 and be a source of accurate and reliable and timely information for our local public. That call center is staffed by public health staff, including nurses, as well as individuals from the Medical Reserve Corps and the University of Dayton Health Center. In total, we have around 60 individuals who have been rotating to staff that call center weekly. Today does mark day 28 of the call center, and as of 4:30 p.m. yesterday, we had seen over 4,100 calls. At our busiest, we were fielding around 250 to 300 calls per day. And call volume has slowed late last week, and we're looking at around 100 to 150 calls per day. Some of the themes that we've been seeing in the call center over the last month, those themes have really evolved since we first began. Early on, it was individuals asking, what is COVID-19? Am I at risk? What are the symptoms? How do I get tested? I've traveled. Now what do I do? And it's really evolved again now to include questions around the many public health orders that have been put in place at the state level. We've had individuals and businesses looking for clarity as it relates to these orders. So when is school out until? Will child care centers be closing? Can you explain to me a bit more about the limited access to nursing homes? What are these non-essential and essential procedures? Can you explain to me what restaurants can and can't do? What are these venues that have closed? Movie theaters, hair salons, and that ultimately again led to the stay-at-home orders. When the stay-at-home orders went in place, we really started to see individuals who were calling to report businesses operating who were non-essential. We had individuals calling to issue complaints on businesses who were not following the appropriate precautions, who weren't social distancing their patrons, who weren't offering ample cleaning supplies. We have, throughout the duration, received calls of individuals requesting PPE for their organization or looking to donate that PPE. We have also, again, throughout the month, the calls still continue around individuals asking about what are the symptoms, do I need to get tested, how can I get linked with a healthcare provider. We do receive the occasional request for social service supports, and we always do our due diligence to refer those to the appropriate source. We are by no means the experts. We've referred calls to United Waste 211, Adamus and Goodwill's Behavioral Health Warm Line. We've sent individuals to different federally qualified health centers to get linked with a provider for a virtual consultation. So just a few of the calls that we are not generally fielding within the call center. We are not the appropriate entity to be handling any concerns related to your workplace policies. If you have questions around your work from home policies, paid time off, you've lost a job, those concerns should be going through your human resources or your appropriate supervisor within your business. And at Public Health, we will not receive your test results. Those test results will first go to the provider who ordered those tests. So if you call our call center, unfortunately, we will not have those results for you. We would encourage you to contact the provider who did order them. And in closing, I just want to let you all know that, again, this call center was stood up so that we could answer all of your questions related to COVID-19, that we can provide you with timely and accurate information, and we will continue to serve you all so long as the need exists. You can reach us at 937-225-6217, Monday through Friday until 6 p.m. And you can also reach the Ohio Department of Health's call center, which is operational 7 days a week until 8 p.m. So when you can't reach us in those evening or weekend hours, feel free to call ODH at 1-833-4-ASK-ODH. Thank you all.
Thank you, Casey. Next, we have Sarah Hackenbrack from the Greater Dayton Area Hospital Association.
All right, good afternoon, everyone. Thank you so much. First of all, I want to thank Casey and the hard work that the team at the call center has done, and they have provided a wonderful resource and partnership for us with our region's hospitals. Early in this crisis, we found that our hospital emergency departments were receiving a significant increase in calls related to general information for COVID-19. And so the partnership with Commissioner Cooper and the staff at Public Health Dayton Montgomery County has been phenomenal to get those calls into a call center where we have experts on COVID-19 available to answer their questions, and that allows our hospital emergency department staff to do exactly what they need to do in the hospital emergency department, which is take care of patients. And so as we continue to look at where we are right now with COVID-19, we are starting to see the real life impacts related to COVID-19 across the state and right here in our own community. As we learned from Director Amy Acton today, that statewide we are seeing now an increase in hospitalizations, we are seeing an increase in the number of ICU patients, and we are seeing an increase in deaths related to COVID-19. We are doing a wonderful job in our community and within our entire region, but yes, we are also starting to see an uptick in our number of confirmed cases right here in the Dayton region. With that, I want to reassure you that our hospitals stand ready to care for you, whether you are seeking care for COVID-19 or you are seeking care for any other critical or emergency situation. We are ready because of everything that the Governor and Director Acton have done to put in place to help us decrease the volume in our region's hospitals, and everything that each and every one of you are doing to stay home and shelter in place to try and operate under this new environment of the shelter-in-place orders, which allows us to increase the capacity in our hospitals and conserve the much-needed personal protective equipment that is needed to care for patients on the front line of COVID-19. These actions have also allowed our hospitals to have a little bit of extra time to plan and prepare and work in coordination with one another all across the Dayton region. And that allows us to work with hospitals as far north as Auglaize County and as far south as Butler and Warren County and share information and plan and prepare together. We've also welcomed the Ohio National Guard into our community, and we have toured with them, as we shared last week, several community facilities. And we have also been spending a lot of time touring our own hospital facilities and campuses to assess the ability to provide additional patient care in unique patient spaces that maybe haven't traditionally been used for that type of care. This has really allowed us the best course of action to make decisions as a region, as in a community, while in concert with the governor's office and in concert with our partners at the Ohio Department of Health, as well as the Ohio National Guard. Because of that, and because of the work that has been done in this region already to prepare and help us get to this point, we are postponing the build out of the alternate care facility in the region. But we are continuing to plan and prepare, which is something that our community does better than any community in the state of Ohio. We will continue to plan and prepare and put the plans in writing so that all of our hospitals and our regional partners, whether that is the City of Dayton, Montgomery County Emergency Management, Public Health Dayton and Montgomery County, all partners that will have a role and information to gather as part of that process will know what the plan is as we continue to move forward. And that will allow us to be ready if we should need the alternate care site in 2 weeks or if we need it 6 months from now. But again, as we've stressed over and over again, our goal in this region is to build out the internal hospital facilities and campus to care for COVID-19 patients right there in the hospitals where they have access to the emergency department space should they have a decline and need to be treated in an emergency environment, or if they need other types of care that can be provided to them right there on the hospital campus and facility. Our hospitals stand ready to care for you and your entire family and this entire community, because we are all in this together, and we would not have gotten to this part and this position to be able to care for patients internally within our region's hospitals and health systems if it hadn't been for the wonderful coordination and collaboration that we see happening every single day. Thank you.
Thank you, Sarah. And with that, are there any questions?
I have one for Sarah.
Coming back. Yes, sir.
What's the reaction that you're in the state suing an Ohio man for hoarding a 95 masks and price gouging?
That I saw the headline, but I have not had the opportunity to look at the details of that situation. So I'd probably prefer to wait and to comment until I've had the opportunity to read the article. Thank you.
I'm not sure who would be best to answer this question. Is the county seeing any kind of increase in ethnic groups, certain ethnic groups getting infected by COVID-19 over others?
You want me to start? So we have so the question is, are we seeing an increase in infection and or issues associated with minority populations or different ethnicities? So the data, we have some data. It's a little too early to indicate, but Dr. Doan talked last week about the fact that the reporting requirements are changing. And so it's not going to be just confirmed cases that are reported, not just laboratory test result confirmed cases. We're also going to have probable cases reported. And those probable cases will be based on symptoms that a clinician would diagnose, as well as epidemiologic linkage to potentially other confirmed cases. So as we start seeing an increase in reported numbers of cases, both confirmed and probable, it's very likely that, well, we'll have more data, and it's very likely that we'll start to see a disparity similar to what's occurring nationally. And so certain population groups and marginalized populations very likely will be more affected by this pandemic than others. We just don't have enough data right now.
Does anybody on the phone have anything for us?
Hi, I do, Dan. It's Danielle with Fox 45 News. This question is for Sarah about the convention center. Hi, Sarah. Hope you're doing well today. I was just wondering, is there any kind of action going on at the convention center right now when it comes to preparing for the possibility of having to have patients there?
Hi, Danielle. Thank you for your question. So Danielle's question was, is there any type of activity happening at the convention center in that physical location to prepare for patients? And right now, no, the activity is really from a planning and preparation standpoint, and that is working with our incident command team, a physician lead, nursing leadership, pharmacy leadership, as well as our Ohio National Guard partners to put the entire plan together, as well as to put together what the list of materials and supplies we would need to order to stand up that facility would look like, and so that we can have all of those ready, that when we reach various levels in our community that we would need to stand up that kind of facility, we have the ability to do that and then stand it up well in advance before we should need to put a patient in that space. Again, something that's important to remember is in our region, we're trying to care for as many of these COVID-19 patients inside the walls of our hospital. So that is the critically important space that we need to make sure we are building and preparing. It's that space for isolation, for intensive care, space where ventilators and oxygen and gases can be used for patients. And the most appropriate location for that is inside the walls of a hospital.